My name's Nico Woodward. I work as an emergency department nurse, but I've put my career on hold to better understand the growing crisis in the New Zealand health system. In 2016 alone, the health budget was underfunded by $1.85 billion. That's the equivalent of 20,000 missing health workers. To highlight this chronic shortage, the Yes We Care campaign has created a shadow workforce to stand together for health.
We're building up an archive of stories that really highlight what it's like for people using the health service and people who are working in the health service as well.
My name's Tia McTeague and I have spondylitis in my back and it gives me intense pain. I can't stand for longer than an hour. There was an operation that I could have, but due to funding, I couldn't go on the waiting list.
There's a call for a national survey to identify unmet health needs, with a new study suggesting almost 10% of us aren't getting the hospital treatment we need.
Many GPs have long given up referring patients who they know won't get seen, patients in pain who have exhausted all other treatment options.
We were one of the first countries on earth to guarantee universal access to hospital treatment, but the government is saying more and more you might have to provide for yourself.
As a perioperative nurse, I see on a daily basis people coming in for surgery who sometimes have had to wait far too long to it. Their health has deteriorated, they may have been in a lot of pain. Some people even have had to leave work.
There are big studies from Europe showing that if you treat conditions early, the complication rates are low, people who are at work get back to work quicker, people who might be retired stay independent longer. My worry is for those people who just can't get in.
Mental health services around the country are at crisis point, with a 300% rise in referrals over the last 5 years.
My name's Patrice and this is my son Brad. He died from suicide. I was very angry because the coroner's report came back that he had received suboptimal care. After Brad died, I wanted to work in the field, specialising in the area of suicide. As far as I'm aware, nothing has changed. The system's underfunded. The onus is totally on the government as far as I'm concerned, and people have had enough.
Our goal is to ensure every Kiwi gets the care they need when they need it. We've got an ambitious plan to make healthcare a key election issue. To do this, we need to build a movement that puts people at the heart of our health system. So join up and share your story at YesWeCare.nz.